Welcome, everyone. My name is Raina Rogalski, and I was a fellow of the Council of Deans in 2022-2023, and I'm a lecturer in the School of Health Sciences at the University of Dundee, Laura, next slide, actually, if you don't mind. So welcome to Who Cares? Yes, well, I'm going to get right into it. So I hope you're at the webinar you intended to register for. We'll get right into it. At the University of Dundee, I organize Diversity Points seminar series, which highlight equality, diversity, and inclusion topics relevant to health sciences and higher education. And part of the group presenting today, depicted here along with our colleague Fidel Lim from New York University, who we've added to our photo there. This group presenting today presented narratives of men in nursing at Diversity Points in April. And this generated momentum that's led us today. It's brought us further collaborators presenting today, and really what's come through from the group discussions and reflections that we've had in that time is really a hypothesis that increasing representation of men in nursing and supporting men in nursing is crucial for the nursing and healthcare workforce and for society. And we'll be exploring this hypothesis today, first by hearing from Eugene Adams, nurse consultant from NHS Fife in Child and Adolescent Mental Health Services. Then we'll hear from Phil Hadenut from London South Bank University for a look at the literature on the topic of men in nursing. Then Kevin Sterling from University of Dundee for discussion of healthcare workforce data, in particular in Scotland. Then we'll hear from some personal narratives represented by John Revis and Ali Mungu from the University of Dundee. In this, we recognize not all narratives can be represented, but through the literature, through the personal sort of narratives, through the exploration of the healthcare workforce data, and finally from Ryan Gleave from Royal College of Nursing, who has collected narratives from a wide range of men in nursing in the UK through focus group discussions. He'll be sharing some findings with particular calls to action based on those kind of narratives and experiences. And to close, we'll share the group's kind of next step that we've identified and invite your involvement. Today is about men in nursing, and this is not to exclude or dismiss the experiences of women and people of different genders in nursing and across healthcare. But the intended outcome of this discussion is to make things better for everyone in healthcare and society. So over to you, Eugene. Thank you, everyone, for being here.
Thank you, Raina. I was the little guy in the previous slide that looked like he walked into the land of giants. So that's me. I'm Eugene. And as Raina said, I'm a nurse consultant in Fife CAMS, Child and Adolescent Mental Health Services. Very grateful for the opportunity to be here today and to share some of my experience that's kind of adding to this conversation, my experience as a nurse consultant. It's quite a privileged position. It's quite an unusual one as well. Here in Scotland, we only have 2 nurse consultants in CAMS services, myself and a colleague over in Edinburgh. And there are other mental health nurse consultants, but only 2 in CAMS. And part of the great opportunity for me within the role of nurse consultant is I still get to do clinical work. So I still get to meet children and young people who've been referred into CAMS. And I usually work with those with more kind of complex presentations. I suppose what I want to share with you today, and kind of feeding into this conversation, is my experience as a kind of nurse consultant in Fife CAMS. I've been around Fife CAMS for about 20 years now. So in that time, I've met with lots and lots of young people and had the opportunity to listen to their world narrative. And what I've been struck by recently, very recently, in actuality, is how different young people are experiencing the world and viewing the world. And it's really concerning me, to be honest. And I'm not here to be doomy and gloomy, I'm here to be honest, and I'm very hopeful as well. But I suppose I listen to this world narrative, and again, it's a very privileged position that I'm in. I find myself in a position where young people want to open up, they want to share, they want to kind of discuss what's going on with me. I suppose I want to share that as a man who is a nurse, my heart's been hurting a little bit recently, folks, from the conversations I'm involved in, the young men, the boys, and the young women and girls that I meet. And just kind of their take on the world in which they find themselves. I have young women tell me that young men are becoming more and more disrespectful towards them in general, and they find themselves in tricky kind of situations in relationships.
Eugene, sorry, is it possible to just go a bit closer to the microphone? It's a little bit muffled.
I'm so sorry, we had that experience earlier as well. Is that any better?
A little bit, yeah. If you could just, lean in a bit, that'd be great. Thank you.
I'll try leaning in. Sorry, folks. For those of you who couldn't hear what I was saying, I was just sharing the narrative that young people are sharing with me about the world they find themselves in. young men, young boys heavily influenced by kind of misogynistic, radicalised and kind of right-wing ideology. Here in Fife Cams, we've referred more young men to the Prevent de-radicalisation programme in the past 2 years than in the past 20. Young girls too, young girls who are holding also quite extreme kind of views kind of on the world. And in my conversations with young men and kind of boys, some of them are asking me directly, why I'm a nurse? Why, as a man, would I want to become a nurse? To them, it almost seems inconceivable. It's become an inconceivable concept that men would want to lean into a caring career. And unpicking this with the young people that are kind of sharing this with me and I'm working with, I've learned that there is a perception out there in existence that men in nursing are somehow viewed as weak by our younger population. That's the kind of influence on them, on their perception, seen as weak or effeminate or even unnecessary. Some of them find it a little bit shocking when they first walk in and find me in the room, as opposed to their expectation of finding a female nurse in the room. I think this ties in with a significant reduction in kindness and compassion in our world on a societal level. And for me, that's really, really concerning. And certainly the conversations I have with young people these days is about helping them to access kindness and compassion, because it feels like it's become a thing that isn't measured in positive terms anymore. That's the negative. I'll stop there with the negative view, as it were. But realising that, I feel driven to do something about it. And fortunately for me, I feel that nursing provides the perfect platform to demonstrate the absolute need for kindness and compassion in the world and the benefit that it brings, not just within the nursing career or the nursing kind of medium, but also on the societal level. I think we, as nurses, can show how nursing is the perfect vehicle for highlighting the need to promote kind and compassionate male role models in a world where actually most of the most prominent male role models are displaying the opposite from kindness and compassion. Their platforms seem to be much more negative and darker. I think a real positive counter-narrative to the current climate of hate, intolerance and misogyny actually is needed. I think it's desperately required. And fortunately, I think this career, this calling, this vocation, I think it's the ideal launchpad for a more helpful narrative at a time when it's really, really needed. I think we as healthcare educators must remind society of the true benefit of having males in nursing. And I think nursing can steer the ongoing people's movement against populism, to be honest. I'm also painfully aware of the reduction of student nurse applications across our nations, and I feel this is directly correlated to this discussion and this narrative and these observations that I'm finding. And I feel compelled to address this. We must address this. Who cares? I care, and we care, and I think we should care together and push for societal changes by positively influencing the perception of men in nursing and providing a positive counter-narrative to the current bleak landscape. Thanks for the opportunity to meet with you today and discuss, and sorry for the muffled start.
Okay, thank you, Eugene. It's really good to be here today. My name's Phil, and I'm a senior lecturer in adult nursing at London South Bank University. And I'm going to talk for about 8 minutes, just thinking about the literature relating to men in nursing. I'm interested in this subject because I'm a man who is a nurse, but also because when I started my nurse training in the mid-90s, there were 26 of us in my cohort, which seems quite alien to some of our nursing cohorts now, and 6 of us were men. And that was really unusual for that time. And I remember we were the talk of the hospital. That it was so unusual that there were so many men in one cohort. And I'm so interested in this subject. I'm actually doing a PhD. I'm a PhD student at London South Bank, as well as working there. And my area is looking at the contemporary public perception of men in nursing. So I wanted to present the literature in a nicer way than just kind of throwing words on a PowerPoint at you. So I popped on one of my men in nursing idols that some of you may be familiar with. So this is Charlie Fairhead from BBC Casualty, played by Derek Thompson. So Charlie is a long-suffering man in nursing who retired from nursing, and Derek retired from Casualty last year. But as I said, rather than just kind of putting inserts from the literature on the screen, I popped some things that I've had said to me over my nursing career around being a man in nursing, and I'm sure to many in the room, you may have come across some of these. I'm going to try and link these up to what the literature says. Obviously, there's lots to talk about, so I could use the whole hour here talking about the literature, but it will be around about 8 minutes. So nursing's been around a long time. I've been in it since the mid-90s, as I said, but the first documented um, nursing as a profession was in 300 AD, and in the fourth century there was lots written about Roman soldiers carrying out nursing roles to their legionnaires who were injured during battle. In the fifth century, we hear about monks um, um, taking on nursing roles, looking after sick people within their monastery. And then through the 1800s, there's lots of reports around men working in asylums or military infirmaries. Up into more recent times in the 20th century, when men were working in a caring role, they're often referred to as wardens. And I wonder if we can link that to men working in what we now call mental health or learning disability fields of nursing. As well as talking about Charlie Fairhead as a man in nursing, we have to talk about Florence Nightingale, one one of the women in nursing founders, and Florence described a nurse as a person with feminine traits, who had patience, gentleness, and caring, and these were all traits that only she felt women had. And that takes us into 1919, when there was the first Act of Nursing introduced that stated that nurses could only be women. That was soon changed in 1922, where the first men was admitted onto the register. Within my research, and I'm looking at a literature review now around public perception of men in nursing, I'm kind of looking at papers dating from 1995 to present day. I'm still seeing things in this time around nursing being women's work, that nursing is dominated by women, and it's a low status, low pay job. Which I can never sit here and say that nurses' pay is enough, but we are getting there. And I think about in my own career that the pay has certainly increased. Status is interesting if you look at the profession that's most trusted. Nursing is always up there, but I'm still not sure we're quite there with it being seen as a scientific career always. The fact that we often see doctors being presented as a he and nurses as a she really reinforce this stereotype that that men in nursing is a strange phenomenon. When we look at what people say about men in nursing, we talk about soft masculinity that isn't normal for your traditional man. And of course, the gay stereotype that men who work in nursing, hairdressing, cabin crew do that because they are gay and maybe more in touch with their caring or their feminine side, further reinforcing this stereotype. Just before I finish, obviously we must talk about what our patients say about men in nursing. And there's lots written about the potential distrust of men. Why would a man want to go into a a predominantly female profession, that we could be seen as a potential threat, and that threat could be to patients and also colleagues. And the fact that it may cause patient discomfort or stop people accessing healthcare. I know that Kevin's going to follow me and talk lots about numbers, but we see around 12% of men applying to come onto our pre-registration nursing courses, and with the attrition that we see, that's when we kind of see the figure of men in nursing that we have in the UK. I'm going to stop there, but happy to take any questions at the end and hand over to Kevin.
Thanks, Phil. So, afternoon, folks. Hope you're having a great Friday. I'm just going to spend about 5 minutes going through some data in relation to men in nursing to give us a bit more of context in relation to what has been said so far and what will come after my short piece. So, let's move on to the next slide, please, Laura. Thank you. So this is my little geek space. This is NHS workforce data in Scotland, and I'm one of these people that likes looking at graphs and Excel sheets, and I started to pull some of the narrative together for this presentation and for the work that we're doing as a group. And in NHS Scotland, and I'm sure there's similar data for the other countries in the United Kingdom, is we have got a challenge coming over the hill, and that is that 23% of our workforce are 55 and over, which means there is the potential that quite a significant number of the workforce in NHS Scotland could retire in the next 5 years. As you can see, the two numbers above Scotland, the average age of the workforce in Scotland is also quite old. It's quite an aged workforce at 44. And on the right-hand side, you can see that the male-female split in the workforce through all of the boards in Scotland is quite predominantly female. The only place where that changes is the State Hospital, which is a large mental health facility in Scotland. Next slide, please, Laura. When we look at medicine, and medicine has gone through quite a seismic change across the UK over the last sort of 5 to 10 years, where they have been able to change and become sort of almost to gain parity in the male to female ratio in their numbers. And as you can see, this is putting them in a far better position with their workforce, is that 12% of that workforce can retire in the next 5 years, and their median age has dropped by about 5 years compared to the national average. So this is one example of where equity and change has been achieved, and it's considering how that might happen in nursing. Let's move on, Laura, please. So this is when you ask AI to generate a Scottish male nurse picture, okay? So I'm sorry in advance, it's stereotypical. But if you go down to the bottom of your screen and you've got the raise hand function, then you got the chat box. If you want to open the chat box and just pop in a number, you know, Phil's been kind in giving you a starter idea, but what do you think the percentage of males is in nursing? If anyone wants to put some numbers in the chat box, feel free to drop them in now. Don't know if that's Jared Butler or whoever that they model it on. But anyway, so let's think about this. So how many males are, what percentage of Scottish workforce is male? Okay, I'm conscious of my time, so I'm just going to keep going. Oh, somebody said 20. That's awesome. Okay, Laura, let's go to the next slide. So unfortunately, it is under, well, the overall average is under 10%, just over 10%. Sorry, we're just about 11%. So as you can see, this is the nursing workforce in NHS Scotland based on the most up-to-date workforce data that we have. And as you can see that we have got quite a swing when we look across Scotland as a country. There are some considerations about geography. NHS Western Isles, they have got almost 94% of their workforce that are female. Again, when you think about the state hospital, that is more equal. In our geographical areas in Scotland, NHS Fife has 8% of male nurses, roughly, which is 350 males in their employment. NHS Tayside has about 11%, and that's about 670 males. So there is quite a change when you compare that with medicine. And as you can see, we have got almost double the workforce that could retire in the next 5 years when you contrast that with medicine. And our median age is almost the same as the Scottish average. Okay, let's move on to the next slide, please, Laura. And as you can see, when we were doing this narrative and these sort of discussions with people, there was this discussion that, oh yeah, there's less men in nursing, but they get promoted faster. And actually, the data would not support that claim. So you can see that Band 3, which is healthcare support workers, and Band 5, which is your newly qualified and your junior nurse, there's quite a lot of bunching in those grades. And actually, there's not the same evidence to support the argument that men get promoted faster and quicker. When you look at the next slide, the female employment by band is pretty much the same. There are 7,500 male nurses in Scotland, and 80% of them work in full-time work. But there's almost 60,000 female nurses, and only half of them work in full-time work. Next slide, please, Laura. And some of the previous campaigns, just feel free to click through, Laura, so we can get everything on the screen. The previous campaigns that have been done to recruit more men into nursing haven't really done much of a seismic change. We have got the purple line, which is down the bottom there. That is the age of the profession, which can retire in the next 5 years. And as you can see, the recruitment for male and females has pretty much stayed static all the way through on the graph here. And there was a publication by NHS Education for Scotland in around about 2019 to advocate for more men coming into nursing, and it hasn't actually affected the overall recruitment of men into nursing. And my second final slide is on the next page.
Sorry, Kevin, my screen's gone completely black. Can you still see the slides, and is it on the right?
No, it's still on the graph.
Yeah, sorry, I might have to restart the share. Sorry, even when I try and share again, it's just a black screen. Raina, could you try and share if you've got it?
Sorry, ladies and gentlemen, we are experiencing technical difficulties.
A lovely pilot voice. I'll try and refresh the actual slide. Okay, I think I can get it.
Thanks, Laura. Great persisting through. Okay, let me just move on to the next slide, and I'll just bring this down to land because I'm just about over time. Okay, so the final thing to showcase is that the traditional campaigns of getting men into nursing haven't been successful. And actually, what we found when we looked at some of the data from NHS Scotland is that the more specialised a discipline is, so down the bottom of that table, midwifery, is the less likely you are to find a male nurse. So the ratios for adult and mental health nursing are up the top, and there's a 1:8 ratio between males and females. But the more specialised you become, the less present males are, and that has an effect on the way that care is engaged with, care is delivered, and care is appreciated. And my final slide to check out on is that Scotland is not unique in this, in as much as other countries and continents have got a very similar sort of experience of the sort of misandry of nursing. Is Europe is pretty much aligned with the data from NHS Scotland, as you can see, 89% female, 11% male. Africa's having some success, and so is the Eastern Med. But overall, there seems to be more that needs to be done to make the case, like Eugene and Phil were saying, for men in nursing. So I shall pause there, and I'm going to hand over to Ali and John, who are just going to share some narratives of their life as male nurses.
Thanks, Kevin. So, yeah, my name's John. I am a man in nursing in lots of different facets over my career. And I guess if Eugene has given us the call to action, and Kevin and Phil have given us the kind of breadth of the quantitative findings of what's going on with some of the experiential stuff, then myself and Ali are giving the depth to individual stories. So we're going to give some of our narratives. So you'll see the heading there, repeating patterns. So I started my nurse training in Oxford in 2002. And like many male student nurses, I came onto a course to find a room saturated with women and a couple of pockets of other men. I was probably, I think I was one of 8 to start with on my cohort of 110, somewhere around that region. I think there was 8 or 9 of us. And within a year, we were down to 4. And by the third year, sorry, my final year, 3-year course in England, I was down to about, I think there was 2 of us and 1 left in the final year. So it felt a bit like Game of Thrones. We were kind of slowly getting eked out, and that interested me from that point onwards. Next slide, please. So I would say I was a reasonably typical male youth. I played rugby and I drank beer and other nefarious activities of that age. And I came onto a nursing course, like I said, to find those ratios. And really, I wasn't 100% prepared for what I experienced as a student nurse back then. Very much seen as nursing was a stepping stone to somewhere else for me. What will you do after you've done that? Do you want to become a doctor? All those kind of things. Some quite interesting behaviors that slightly shocked me as a young guy. Over-sexualization of young men by female colleagues. So if I was half your age, all this kind of stuff, half my age, all this kind of commentary and whatnot, which absolutely wouldn't have been tolerated the other way around. So some quite interesting experiences, and the story followed me through until I became a lecturer and observed how classrooms work with male students, what it meant to my students. Next slide, please. Thanks, Laura. So there were some other interesting things happening around the time that I graduated, I suppose. This chap, Benjamin Geen, some of you may know, he's not quite as famous as some of the other infamous characters in nursing over the last couple of decades. But I worked as a student. I say I worked. I was a student on the department where this chap was working, and witnessed him arriving at cardiac arrests. I was working with the bleep holding nurse at that point, and very excited to be following her around and seeing what was going on, to find this very confident, capable chap who would come into situations and be all over it. And it turned out, of course, that he was not the greatest role model, and actually was potentially engineering these situations and living for the thrill of it. Now, that's not to say that I'm saying men come into nursing for that reason. He was an example, though, that actually impacted me quite a lot, because it brought up a lot of questions from people about the intentions of males in nursing. So the idea that, why were we coming into nursing for some access to people, for some, you know, again, nefarious kind of activities? What was the underlying thing? There's something slightly creepy about it. You know, some narratives that I experienced from patients and through conversations that you hear. You know, what is it about coming into nursing as a man that what attracts you to it? And I really felt like you kind of have to defend your position. So I have those conversations now with my students, my male students, about, you know, how they are experiencing being a man in this situation, and it's tough. So as a lecturer, I would say over the last few years, I have seen my classes follow similar patterns, particularly for younger men coming into nursing. I was lucky enough last year, well, for the last 3 years, to have a class where I had 2 guys come in through the HNC route in Scotland in their second year, second career people, not dissimilar age to myself, and watch how much more solid and firm grounding they were on when they came onto the course compared to some of the younger guys who really struggled to actually engage and socialize themselves into that big room of females. It wasn't that people didn't try to do that. It wasn't that there was any obvious shunning of people or anything like that. It is just a barrier that presents itself. So I like to think about what it was that got me through my course and try and share, and, you know, to this point in my career, and share this with people. And I think if you could put the next slide up for me, Laura, please. This is me with 2 chaps who I worked with up until 2019 back in Oxford. That's the old Radcliffe Infirmary. So shout out to Oxford Brookes and Oxford Uni fellows if anybody's here. These guys I started working with in 2005 on the neurosciences ward. In fact, I worked with both of them as a student in my first ever placement, and they were my role models, and they were my soundboards. They were people who I could go to for support. We would continued after I stopped working there to meet every year. This is at Christmas, and having that importance of those role models and people that you see, can see, you want to see what you want in people in your career, in how you want to behave, is incredibly important. So I try and really push that with my students, and I think that is something that needs to be acknowledged. Is it's not just about getting people in, it's about keeping people in nursing. It is a challenging world as a man to come into nursing, and that's really the message I'd like to leave you with. We need to think about how we support particularly young men to come in and then stay into nursing. And that's my section over, so I'll hand over to Ali.
Hello.
Thank you. I'm just going to reshare quickly, Ali. Sorry, that was actually Raina who was sharing
Okay.
there. So let me just bring this back up. Great. Hopefully you can all see that.
Thank you. Thank you very much, Laura. Yes, my name is Ali, and I'm just going to share with you my my story of being a man in nursing in the UK, having been originally come from Zimbabwe. So my background is a primary school teacher. So I was a primary school teacher in Zimbabwe and came to Scotland, where I eventually decided to go into nursing. So when I joined as a student, I was surprised, particularly when I went on placement, to see the transition of what I used to be, you know, as a primary school teacher, a man with authority, a person who, you know, everybody respects, and you come in and you are suddenly in the minority. And this took me to this negotiation of what I've called a triple jeopardy, where, you know, being a man, a man in nursing, you're seen as the minority. Particularly for me, it was a bit difficult, because not only was I in the minority, I was also a black man in nursing. And then, but at 9 Wells, there were only 2 black nurses in the whole of the hospital, so which made it a little bit difficult. And what was common on every shift was to be asked where I came from. So to begin with, just trying to negotiate being asked every day where I come from, I didn't appreciate it because I thought, why are you asking me? Why am I the only one who's being asked where I come from? But with the time, I learned to accept that identity, through one of my 90-year-old patients who pressed the bell and said, can you go get me Ali? Can you go get me Ali, my blackness? And if somebody refers to me like that, the first instance is perhaps to frown upon that. But to me, it was some kind of endearment to say, okay, out of those nurses out there, there is a black nurse. I want to attend to me. So that's when I started to see my contribution as not only as a black man in nursing, but also as a man in Africa. In addition to that, one of the questions again that question that I asked about, where do you come from? I started kind of answering in a good way, telling my patients where I come from. And what normally follows is something very interesting. You start sharing, listening to a patient talking about a nostalgic journey, or when they were in Africa. They would say, where do you come from? I come from Zimbabwe. I was in Zambia. I was in Nigeria. It might be thousands of miles away, but it gives an opportunity for patients to start talking about themselves. Gradually, I realized what I was offering patients by just being there as a Black person. I was giving the chance for patients to be a human being, not to be a patient, because they were able to now reminiscent with them, talk about the stories, talk about their experience when they were young, when they were in the army, when they were traveling around Africa. At that point, I can see the face of the patient shining, because they are being seen, or they are saying to themselves, now here is somebody who knows where I come from. And that is actually it has also an effect on me, because I'll be saying, oh, now there is actually a patient who knows where I come from. So that has been something that has been endearing. In addition, being a man in nursing has been, for me, it has been like some kind of a career springboard, where I have managed to develop the professional. It has given me some professional attainment, and from having a degree in nursing to studying, to having 2 masters, and to having a PhD. That academic excellence has been actually a personal achievement. But a flip side of that is that this is kind of related to the literature that we have just had, because one of the citations that comes out of literature is the question, or the particularly from my African heritage, that people kept on asking me, when are you going to be a doctor? Did you not get enough grades to be a doctor in that university? So when I look back, that must have pushed me to go on and study this way I have studied and attend a PhD. But all the same, I'm not going to regret it, because now I'm teaching at a university. I'm living a happy life. I'm earning much more than what I would have earned. So in a way, while it might be seen as in the negative, as something that is good, what I'm going to leave with you is that nurses from across the globe, there is something rich. The diversity that they bring in is so important, but we just need to identify, or help them identify that the diversity, that difference, is something that they can offer our patients, particularly when patients are able to talk about their experience, not only to be seen in the negative, because the tendency for us is just to think that because they are asking me where I come from, probably I'm being discriminated. It's not that, but it takes a lot of time for people to understand that. Thank you.
Good afternoon. I'm Ryan Gleave. I'm one of the lead nurses for independent health and social care at the Royal College of Nursing. We started a really small project earlier on this year, just looking at men in nursing. And the idea around the project is we'd identify probably between 5 and 10 men who would help us write some blogs, create some narrative around some positive messages and some positive role modelling about how great nursing is, and how it's actually a profession which is a suitable profession for men to enter into. The result of that, I mean, leading this project, I was not expecting kind of a lot of people to be interested in it, but like I said, we were looking between 5 and 10 participants. What we ended up having is just over 240 people contact us and say we want to be involved, which I mean, with the best one in the world, we weren't going to be publishing 240 blogs. So we have to have another look at this and see what we could do with all of these very, very interested people who had contacted us to say, yes, we'll write a blog, had a lot of individual contact. So we, over the summer, ran about 5 very informal focus groups just to have a look at what brought people into nursing, what had their experiences been, so the barriers, the successes, and what advice they would give to people coming into nursing as men, and to look at what we could do as a college using our platform to encourage more men into the profession. As colleagues were saying earlier, a lot of that, everyone's experiences were very different. There were a lot of commonalities. I mean, what came up a lot during these focus groups was, again, the assumption about people's sexuality. Got to be gay to come into nursing, which some people were finding difficult when it doesn't match their sexual orientation and their identity. Some people objecting to it because sexual orientation, what's that got to do with the profession? I think some of the other stuff which came up, violence and aggression came up quite a lot with a lot of participants, talking about how if they were encountering drunken or violent patients, then that the male nurse would be sought to come and manage this and lead on managing this away from their female colleagues. And also, if they were physically attacked or verbally assaulted, the support around the man afterwards was not the same as it would be for people elsewhere on the gender spectrum or women. Seeming like men, you're more equipped to deal with being punched in the face than anybody else. So there was something around what support we can give around violence and aggression. Probably one of the other things, I'm not going to go through all of the things that have come out of those focus groups, because one, I've not got enough time, and two, we've not finished all the analysis of the information, but is that the isolation men in nursing were feeling as a minority within those professions. They were talking about the lack of support, the total isolation, and I think John was saying before, the mistrust people have around men coming into nursing and what the motivation around that was. So there's some work we're going to look at as to how we can support and address that. And I think what also came up quite strongly was the provision of intimate care or personal care to female patients, where there was almost a double consenting. So consenting to the procedure, but also, is it okay if a man does this? Which is not the case for male patients. So we're still looking at all of this information to see where we can pull out some work strands, and also work with this wider group, which has to see where we can collaborate further with and progress this work, to see if we can build on the momentum which is already out there, because there has been a lot of enthusiasm about this from us. I'm going to stop wittering on now. It's Friday afternoon. I can feel my voice going, and I'll hand you over to Raina.
Okay, thank you everyone for presenting and sharing, and for everyone listening in. To summarize, today we've been exploring a kind of a nurse-led movement to promote a more just society and workforce by thinking about how to increase male representation in nursing and how to support men in nursing. So we've identified as a group that these are sort of priority themes around recruitment and supporting. We looked at the healthcare workforce data in Scotland, we looked at some lived experiences, which we acknowledge is just a starting point and are not representative, of course, of all experience of men in nursing across education, research, practice, and leadership. And we also recognize that we need to hear from everyone to make this truly make the change. I've seen there's some great questions in the chat, which hopefully we can kind of start to address, which of course really requires people speaking up and sharing, like today, and wider conversations, allyship, and a recognition of the wider context in which we live in terms of gender equality. In terms of the workforce, what we were thinking about is the importance of valuing diversity in the workforce. So if we have increased male representation in nursing, there's that's a recognition of the value of diversity. And like Ali spoke about as well, the intersectional considerations for valuing diversity in the workforce. It's part of enhancing patient experiences and representation in terms of bringing people into the profession to meet the needs of the workforce. This discussion is about interrogating recruitment strategies and avoiding perpetuating stereotypes, which of course would benefit all people coming into the profession. Regarding people in the profession, thinking about how to retain and support them, we've talked about appreciating the importance of well-being and achievement and success, and looking at targeted approaches to doing this through mentorship and, for example, the potential benefit to society of greater male representation in nursing. For us, that relates to the fostering of care and compassion, like Eugene started us with, challenging toxic masculinity and misogyny in society. Other reflections we've had on increasing male representation to benefit the workforce and society relate to the importance of engaging with our students and sharing experiences and being an ally, as I sort of started with, and just sort of involving everyone in this discussion. As we started, we're focused on men in nursing today, but it's important to consider the wider context in which men in nursing are sharing their experiences and those working with them. And we hope that this conversation, I suppose, will inspire and invite your participation. So we've kind of at the next slide, Laura, we've put together a sort of form that asks for your potential interest in getting involved in our next steps. We're going to have a meeting in the new year, and any feedback about this presentation that we could kind of use as a starting point for kind of further collaborating together. So I do see quite a few questions in the chat. I'll kind of end there and give you an opportunity to open the form, which will be available to you after the meeting as well. Colleagues, can everyone see the questions? I'm not sure if we can start answering through chat, but also kind of out loud in these last remaining minutes.
Yeah,
I think, yeah. John, do you want to come in?
I'm happy to come in for that first question. How do we improve the experience of male student nurses in training?
Great.
Yeah, I think that's the thrust of my kind of experiences and really what I want to try and improve. I've seen lots of different things done. Colleagues back at Oxford Brookes, Dan Butcher, who was one of my colleagues there, you may know him. He did quite a lot of work trying to kind of engender social groups for male nurses to be able to talk. I think that's quite a helpful idea. I think we do need to potentially have spaces to allow people to air how they're experiencing things, especially when they're going through things, going through their training. And I guess potentially as well, it's about airing the issue. We air a lot of issues with our students, and actually being able to acknowledge it and talk about it can sometimes help everybody understand that this is a problem. It's not just always about saying, well, we have to support the man. It's about educating and socializing people, everybody in the room, to understand that may be an issue. So that would be my answer to that particular question.
I could probably speak to the second question, Rena. Can I clarify though that I'm not muffled? Can you hear me? Kind of. Okay. So the second question was that, can you say a bit more about your vision for societal change by having more male role models in nursing roles? Absolutely. We need to be brave and we need to be bold. We need to promote this message. We need to get it out there. We need to do more of the same in some respects. This has been a fantastic opportunity to share our kind of our work and our kind of conversations with you guys. Again, can you point us in the direction of other platforms where we can raise this and have these conversations? And again, I think it's about being brave and bold and challenging and providing that counter narrative, because I think ethically and morally we need to. I think we're standing on a little bit of a precipice in a societal from a societal perspective, and I think we need to pull back. We need to be confident and proud of expressing that kindness and compassion are wonderful human traits. And again, the vehicle of nursing is a great way to deliver kindness and compassion. And for this particular conversation, identifying and showing, demonstrating that men can be kind and compassionate, kind of counter narrative to kind of the growing perception of males in the world. I hope that makes sense. I could talk to this for days, but I'm conscious that we've only got a few minutes left. But thanks for that question.
Go ahead.
There was a question from John, and I typed an answer to it when you folks were talking about the bigger challenges. So hopefully that answers John's question. But for everyone else, John was just asking, why do you think recruitment campaigns for men have not succeeded? That's a summary. And I think it's because we haven't had this articulation before of the role of men in nursing. I'm not being negative about that report that NHS Education for Scotland did, but it was predominantly written by females, and it was taking one slant on how to solve the problem. I think the recruitment campaigns for nurses in the past have been, we need to get men into nursing, and there's a full stop. There was a full stop there. There wasn't a, this is why we need men in nursing. And I said that if you were in midwifery, that there was a 1 to 380 ratio of finding a male nurse. When I did my midwifery placement, I went to the Western Isles, and they had to get permission from the chief executive for a male nurse to go into the obstetric unit, into the midwifery unit for their placement. That never happened with females. But my placement was delayed until there was permission for the chief exec for me to go in. Now, that was 30 years ago, but what I'm saying is we need to understand about that sort of parity and equity of access to show the value of a male in nursing and how it can enrich the workforce. So I think the campaigns have been misaligned before about just getting men in, and we haven't articulated the why and the value.
I think also for me thanks everyone, the question about how can employers support career progression for men in nursing without creating perceptions of favoritism. I won't pretend to have answers to any of these questions, but to comment on
Can I come in on that? The last question, how can employers support career progression for men in nursing without creating perceptions of favoritism? I think we have the same thing in higher education, where there has been a promotion for promoting women in areas of management. I think the same thing can be done in nursing, where we use affirmative action, but it has to be explained so that everybody knows why we are doing this. Like what Kevin has said, explaining the value. What is it that a male nurse can bring? Perhaps that might be missing. Just having patients seeing, or male patients seeing that men is also part of the nursing. It is that value that needs to be kind of spoken about, so that at least the female nurses themselves, they understand why we are carrying out this affirmative action. Because when it's being done in higher education, we have accepted it, and it's still being done, and so it might also be the way to go. Take away the word favoritism, but to use it as affirmative action. Thank you.
Thank you. I was going to add as well that just sort of think about the wider context in which this conversation is existing, in terms of, I think, with a point about the perception of favoritism being, there's a concern that favoring men in our context where there is gender equality, in wider gender equality against women and other genders. I suppose for me, it's looking at how this conversation benefits everyone, and how we can see that there's that link to promoting men in nursing and increasing male representation in nursing, supporting men in nursing, benefits everyone. It benefits us. I think that's really the crux of our message, is that if we can get that consensus that actually we're thinking about nursing as such a powerful vehicle for change in society, patients, directly to patients, but also on a societal level, being like Phil pointed to, the trust of the profession and the potential for the position of the profession to make a difference. We can amplify that space. And again, I think that there's that care and consideration around how to speak about gender in a way that is inclusive of everyone and promotes things being better for everyone. So it really requires all of us thinking, and there's more of a sort of academic theoretical stance that we could be kind of exploring together. And that's part of our sort of next steps as well. But hopefully there has been, and yes, those identifying as non-binary, trans people, there's across gender, and we want to be inclusive of those experiences. We didn't have that kind of fully represented today, and we wanted to acknowledge that. But I suppose there's that idea that gendered considerations benefit everyone if we can be as inclusive as possible and think about gender as something that matters to everyone and is significant, and what we have in these perceptions are negatively affecting everyone. So these norms and perceptions affect everyone negatively. So how can we kind of, as nurses and as a profession, change that? And I think that's where we're curious. That's really, this is a big, we're just curious, and we're excited about this opportunity to kind of explore and present and connect. So that's really where that QR code hopefully will engage some of you to sort of take steps further with us. And I think, yeah, so there's avert negative attitudes towards men in nursing, and being aware. I think it relates to I see hidden prejudice and just bringing things out into light. And I think that's what this group has also tried to do by sharing their experiences, for which I'm very grateful, to be able to kind of bring stories out and create discussions that, again, hopefully make things better for everyone. I'm not sure if anybody else wants to add anything to that question or anything else to close. Kevin?
I just want to thank, do we have that QR code again, Laura, that we could just, thanks to those that have already signed up. That is awesome. Great way to start the weekend. If you want to take if you want to help and if you want to guide where we go, because this is the start of a conversation that will get bigger, feel free to scan that code and we will reach out to the folks that have contacted us, and we will try and develop this narrative with you as a community.
Thanks for that, Kevin. And also, John made the point about feeling free to share this with others. If you know, to that who may be interested in getting involved, that we'd welcome hearing from everyone.
Yep. Awesome.
So thank you for joining, and so much to the Council of Deans of Health for having us.